Hi, my name is Yuko Ueda.
Hi, my name is Steve Lawson, and we're on the marketing team for GE Healthcare MR. So welcome to MR Crosstalk. A few years ago, we launched some new coil technology called the Air Coils. So we'd like to talk a little bit more about that today with you.
Yeah, because coils and positionings are very important to achieve the best image quality in MR, right? So please tell me your experience with the air coils.
Sure. So the Air Coils offer a lot of versatility to our customers, and maybe you have a patient that cannot lie on their back, possibly for a lumbar spine exam, which would be really hard to do unless you have a surface coil directly on their back. So the Air Coils are very lightweight and very being versatile and flexible and easy to move, so you could easily position this on a patient that couldn't lie on their back, maybe in the decubitus position where the coil is directly on their back. So it makes it much easier for the patients, and it's quite easy for the technologists to be able to position the coil. So other anatomies that could be difficult in MR is like, say, doing a long bone, like a humerus exam. You know, a rigid coil wouldn't wrap around the anatomy, and this is where the Air Coils can be really nice to get great image quality, because the coils would be directly around the tissue that you're imaging. So it's a great solution for those types of exams.
Yeah, exactly. And these days, whole body imaging is getting really popular, and we have a really good solution with the air coil, right?
We do, yeah. So when you have these coils, you know, they're quite long. So the Air AA is about 65 centimeters long. So when you're doing a whole body exam, you could easily place two of these on a patient, one at the upper area and then one at the lower legs. And then you're able to do that quite easily. So combining these coils together and using a technology that's on the system called AirTouch to automatically select the coils for you, so the technologists don't have to think so much when they go across the different coils. So it makes it much easier in regards to workflow from the user interface, but then also it's quite easy to set up too.
Ah, great.
Okay.
So as Steve mentioned, air anterior array coil has a really wider coverage, and customer utilize those coils for abdomen and the other, various anatomies. But when they want to scan some extremities, like a smaller anatomy, Air AA coil is a little bit too large to scan those, smaller patient and anatomy. So these days we just released Air multipurpose coils, which is more smaller size and keep flexibility and lightweight, which is easily handle and scan smaller anatomy, right?
Yeah, so the coil being so long for the anterior array, 65 centimeters long, it's a bit more than what you would need for doing maybe a shoulder or a hip or something like this, or a knee. So we've got these smaller coils with the MP coils, and it makes it much easier to position. There's immobilization devices for doing a knee or an ankle. Makes it very easy to position and set those up with the Air MP coils. So they come in two different sizes. So there's a medium size and a large, but it's shorter than the Air anterior array, which you would do for most of your body imaging. But yeah, it's a great solution for doing musculoskeletal exams.
Great. As Steve mentioned, air coil can provide really good positioning productivity. At the same time, air coil has a higher channel count, so we can expect more acceleration, right?
Yes. So in addition to being lightweight and flexible, once you set at the operator console, you want to do some things to be able to reduce the scan time for the patients and allow you to have better productivity that way as well. So these coils have an increase in the channel count, allowing you to use higher parallel imaging factors than what you traditionally could be able to do. So that's great because the scans are much shorter and you're still able to maintain really great image quality with those.
Great. Nowadays, cleaning capability is so important. Many customers is taking a lot of time to clean equipment in between patients.
Yes.
How about the air coil? It looks like easy to be cleaned.
It is. The material of the air coil is a very slick surface, so you can easily just wipe and clean, no problems at all. There's no grooves or cracks or anything like that because the material is a soft fabric-like material. So you can just simply wipe each side, and it does a really easy job to do this. And overall, it can actually lead to better workflow and productivity having this type of material. So
Great.
it's very nice.
In fact, patients have many challenges due to their condition and disease. So we would like to make their MR experience simply better with air coils. Faster scan is more comfortable for the patient, so it's totally win-win.
So the air coils provide a solution for many challenges. For all of these reasons that we mentioned today, the air coil won the Best New Radiology Device Award in 2019 from Aunt Minnie. So please schedule a one-on-one demo with a GE representative today.